you can start.
Hi, good afternoon, everyone. Yeah, today I'd like to share the topic of Ganoderma and stomach disease. Yeah, thanks. First, we have a disclaimer. Okay, all the information contained in the slide are intended for general health information and educational purpose only, and are not intended to be used as a substitute for a professional medical advice, treatment, or care. Yep. Next. Yeah. Okay. Let us understand a bit of what is digestive system. As a stomach is one of the organ in this system, and the main function is to convert the food we eat to energy and the nutrient for our body. So the digestive system include the mouth, pharynx, which is the throat, and the passage, the esophagus, and stomach, small intestine, and then large intestine, then all the way go to rectum and the anus. So it also includes the saliva glands. Next, we look at what is stomach and where is it located. So the stomach is a muscular organ, actually located on the left side of the upper abdomen. So the stomach receives food from the esophagus, which is the tube. Okay, the esophagus is the muscular tube that carries food and liquids from your mouth to the stomach. So when you swallow food, it actually travels through your mouth and into the long tube called the so-called the esophagus before entering your stomach. So as food reaches the end of the esophagus, okay, it enters the stomach through a muscular valve called lower esophageal sphincter, so-called LES. So for this normal function of the LES is to allow the food transit from the esophagus into the stomach. So LES will then actually close like a valve to prevent the reflux of the gastric back into the esophagus. So when food enter the stomach, it will secrete acid and enzyme to digest the food. Stomach has 4 layers internally. So the first layer is the mucosa layer. So the layer will create a protective barrier to protect the stomach wall from acid and the digestive enzyme. Yeah. So inside the stomach, there are also muscle tissue called rugia that has the ridges line. So the purpose of these ridges is to increase the surface area of the stomach when the stomach is full, so that it can actually can be stretched out to increase the stomach volume. Yeah. So also the stomach muscle will actually contract periodically. So to actually churn out food and to enhance the digestion. Yeah. So next, when the food is ready to move out of stomach, okay, there is another muscular valve called pyloric sphincter. It will open to allow the food to move from the stomach to the small intestine. Yep. Okay, so next. So next we look at the stomach diseases. So the common stomach diseases are gastroesophageal reflux disease stomach, commonly known as a reflux. Next is a gastritis of stomach. Third is a stomach ulcer. Fourth is a stomach cancer. We will cover the detail in the next few slides. Yeah, next we will look at the gastric cancer, the statistic. So the which is related. So next we will look at the statistic. Okay, for gastric cancer, which is related to stomach diseases. Yeah, in terms of stomach cancer, every year is about 800,000 deaths worldwide. So in Singapore itself, it is ranked fourth and fifth causes of cancer death in male and female respectively. And gastric cancer is curable if it's detected early, but it is traditionally associated with the poor prognosis, meaning the chance of recovery is low. So you see, based on the data collected, 79% of patients are diagnosed at stage 4, and their 5-year survival rate is less than 5%. That is why early detection is important. Yeah. Next, please. Okay. So we'll look at the first one, get the stomach disease, which is the gastroesophageal reflux disease. So reflux happens when the food exit and bile in the stomach move back into your esophagus. So when this happens 2 times or more in a week, it is called gastroesophageal reflux disease, also known as GERD. Okay, so the symptom is heartburn and irritate in your esophagus lining, because esophagus does not have the protection layer like stomach. Yeah, so yeah, the risk factor for this cause is here are the few risk factor: obesity, smoking, pregnancy, asthma, diabetes, and hiatal hernia. Hiatal hernia is a condition where the upper part of your stomach actually bulge through your diaphragm into your chest cavity. Okay, so but at a large hiatal hernia can actually allow food and exit back up into your esophagus, leading to heartburn. So the next risk factor is the delay in stomach emptying. So meaning the food sit in the stomach for too long, which can cause bacteria overgrowth from the fermentation of food. Okay, so another risk factor would be scleroderma. So this is a group of rare disease, very rare disease that actually involve the hardening and tightening of the skin. It may also cause problem in the digestive tract. Okay, scleroderma can affect any part of the digestive system. Yeah, from the esophagus to the rectum. Another one is the Zollier-Ellison syndrome. So meaning that the tumor cause the stomach to produce too much acid, resulting in peptic ulcers. Yeah. So next, we look at next, please. Yeah. Next, we look at another disease, gastritis. So gastritis is an inflammation of stomach lining. Acute gastritis is referred to the inflammation comes suddenly. So when it happens slowly over time, it's called chronic gastritis. And the symptom would be hiccups, nausea, vomiting, indigestion, bloating, okay, appetite loss, and black stool due to bleeding in your stomach. Take note that gastritis doesn't always have the symptoms. Yeah. So here are the risk factors. Okay. If you have stress, bowel reflux, if you happen to have stress, okay, prolonged time of stress, and you have bowel reflux, always have bowel reflux from your small intestine, drinking too much alcohol, okay, chronic vomiting, okay, for a very long time, and also long-term use of non-steroid anti-inflammatory drugs. So these are the high-risk group. Another group, if we having the bacteria or virus infection, you will have a high risk of getting this. Next will be the pernicious anemia. So pernicious anemia is the so-called the relatively rare autoimmune disorder. that resulting in a B12 deficiency, meaning they have not enough vitamin B12 for red blood production. Okay, because our body need vitamin B12 to make red blood cell. You get the vitamin from eating food such as meat, poultry, shellfish. So a special protein, okay, I bind the vitamin B12 so that it can actually absorb into the intestine. Yeah. So the last one would be the last group would be the autoimmune disease group. Yeah. So these are the high risk group. Next. Next will be looking at the peptic ulcer. So peptic ulcer are open sore that actually develop on the inside lining of your stomach and the upper portion of your small intestine, which is the lining of stomach has broken down. Yeah. So the symptom would be abdominal pain, nausea, vomiting, ability to drink water or fluid. Yeah. Feeling hungry soon after eating. So these are the few symptoms. And you also may experience fatigue, weight loss, okay, black stool, and chest pain at times. And the risk factor and the cause would be due to this is a Helicobacter pyrobacteria. It's a kind of bacteria. Okay, this bacteria is that how we get this bacteria is that through contacts. Okay, through contact. So hygiene, related to hygiene. Yeah. So excessive alcohol consumption, and as usual the NSAID, which is a long-term use of a non-steroid anti-inflammatory drugs, and tobacco means smoking. The next group will be a radiation treatment. Under the radiation treatment, okay, using a breathing machine or Zolian Ellison syndrome. So these are the few high-risk group, okay, for this peptide ulcer. Next. Next is the so-called the Hiatal so-called hernia. So hiatal hernia is a gap in the muscle wall that actually separate your chest from your abdomen. If your stomach slide up into the chest through this gap, you will have a so-called this hiatal hernia. Possible cause could be age-related, okay, or changes in your diaphragm, or you have injury to that area. So the symptom, it could be bloating, okay, pain, and a bitter taste in your throat. Okay, so just I mentioned about the high risk will be overweight and age related, over age 50, and also if you are a smoker, you'll be in a high risk group. Yeah. Next, please. So next will be another disease, gastroparesis. So this is a condition in which so-called in which your stomach take too long to empty, meaning the food remain in your stomach for too long. Okay, rather than should be moved into your small intestine to be digested. This is a so-called functional disorder affecting your stomach, nerve, and muscle, because it makes your stomach muscle contraction weaker and slower than they need to be, okay, to digest the food. Yeah. So the symptom would be nausea, vomiting, and weight loss. Okay, weight loss because you don't getting the nutrient. Okay, that's why you have this weight loss problem, and bloating, heartburn. Okay, so people are more likely to experience gastroparesis if they take certain medicine, such as some medication for diabetes, as that might affect the intestine and stomach. Another high risk group would be the so-called under the vagus nerve surgery. Why? Because this is because when it happens when your vagus nerve is damaged or stop working. So this vagus nerve actually control how food move from your digestive tract. Okay, when this nerve doesn't work well, food move will be slow and sometimes stop moving. Yeah. So another group will be another high risk group will be anorexia nervosa. So which is so this is a condition which is the eating disorder. Okay. So this happens when you keep on restricting your intake of food. Okay, your gut mortality will actually slow down. Yeah. So the next high risk group will be post-viral syndrome, meaning um, uh, this happened after having a different kind of virus, many different kind of virus infection. Yeah, and another high risk group will be include some of the disorder that muscle disorder, nervous system, and or metabolic disorder. Yeah, so these are the risk factor. Next, we'll look at the stomach cancer. Yeah, so stomach cancer also called gastric cancer. Yeah, also known as gastric cancer. So this cancer is characterized by a growth of cancerous cell within the lining of the stomach. Okay, so this happens when there is a growth of cells in the stomach. Yeah. So the symptom would be nausea and vomiting, and frequent heartburn, loss of appetite, sometimes accompanied by sudden unexplained weight loss, constant bloating, always feel bloating, and early satiety. Okay. So meaning when you are unable to eat a full meal or feeling full after eating only a small amount. Okay, so this is called early satiety. Yeah, and the risk factor would be those affected by the so-called H. Just now we say Helicobacter pylori bacterial infection, or you have tumor in other part of the digestive system. Okay, so stomach polyp is also a risk factor. So stomach polyp is an abnormal growth of tissue that actually form on the lining of the stomach. Yeah. So these are the few high risk group. Next. Okay, next we'll look at the so-called diagnosis of the stomach disease. So the first one is the physical examination. So they will evaluate for tenderness or abnormality like swelling, rigidity, or masses. So the doctor will actually press and check. Okay. So the second one is a breath test. Okay. So the breath test is actually to check for what? To check for the H. pylori, which is a Helicobacter pylori bacterial infection. How they do is that during your breath test, the doctor will actually ask you to actually exhale. The first time they will actually ask you to exhale into a balloon-like bag. So this, when you exhale, they will actually have the so-called the carbon dioxide. They will collect it and do a measure. Okay, do a measurement. So next, they will actually ask you to drink a solution. Okay, a small amount of solution. Then after that, this after a while, they will actually ask you to exhale again into another bag. Okay, so when this time we exhale, the so-called the carbon dioxide, they actually do a measurement. So they will compare these two measurements. If the second measurement is higher than the original first one, then you're considered positive for this so-called you have this so-called pylori bacteria this infection. Okay, this pylori bacteria actually were actually in contact with this solution at time, they will actually release more carbon dioxide, more carbon, in fact. Yeah. So when you exhale, this more carbon together with the original carbon dioxide will actually exhale into this for measurement. Yeah. This is how it being tested. Yeah. So the next one will be imaging. Yeah. So imaging, we have upper endoscope, scopy. For this test, you'll be given a medication to help you relax. So during the examination, during the exam, the test, your healthcare provider will actually track a long flexible tube, okay, with a tiny camera, okay, the endoscope, attached down your throat and esophagus and into your stomach and the first part of the intestine. Yeah. So this instrument allow the doctor to actually view if there's any problem in the upper digestive tract. So they may also take some tissue sample, okay, for biopsies and to examine whether is there any H. pylori infection. Yeah. So the next test would be uh, barium swallow. So this is an X-ray imaging test. So sometimes they use this to evaluate the disorder of swallowing, stomach ulcer, and hiatal hernia. So this test involve drinking also a solution, a liquid that contain barium. Okay, so this barium is a substance that actually make parts of your body that actually show up more clearly on the X-ray. Yeah. Next, please. We'll be looking at the treatment of a stomach disease. So for treatment, first one will be lifestyle option. Yeah. So to treat the reflux problem, the first one will be losing weight, right? Because if you are overweight or recently gained weight, okay, because of that extra weight on your body, put added pressure on your stomach. Yeah. So this can lead to more stomach acid traveling up into your esophagus, which can cause all the uncomfortable symptoms. Yeah. So next, do some adjustment. The second one is to do some adjustment, okay, by elevating the head of your bed, okay, when you sleep. So for example, placing a foam weight pillow underneath the top of the mattress. So when you do this, the gravity keep the stomach acid down, so preventing stomach acid from entering the esophagus. So you lie down may actually cause food to actually come back up the esophagus and into your mouth. Yeah. So next would be avoiding meals 2 to 3 hours before bedtime. Yeah. So this will actually help to reduce your stomach acid and allow enough time for the stomach to partially empty its so-called content before sleep. Yeah. Okay. Another so-called the next one will be on medication. Yeah. So medication, the first one is acid reducing medication or antacids, which are the this antacids is the which are the medicine to reduce the amount of acid in your stomach, so as to relieve your heartburn and indigest problem. Next is to take antibiotic. So this antibiotic is for the stomach infection and inflammation. Yeah. So as to get rid of this so-called H. pylori. And the next one will be increase the rate of stomach emptying. Okay, for using this so-called another medicine, metoclopramide. Yeah, and the last option will be surgery. Yeah, so surgery is to tighten the lower esophagus, so-called the sphincter, and prevent the stomach fluid from entering the so-called esophagus. Yeah. So yes, so these are the few treatment options. Yeah. Next. Next, we'll look at how can we prevent stomach disease. Yeah. So first is from diet. Okay. Eat smaller, more frequent meals because large meals cause the stomach to expand, which prevent the sphincter, so-called the valve at the top, okay, of your stomach from closing completely. okay, resulting in the so-called the food we eat still in the stomach, okay, will actually wash it back up. If it's too full, okay, it will actually wash it back together with the acid back up into your esophagus. That's why the acid in your stomach make you feel sick. Yeah. So next is to avoid fatty and spicy food that can trigger the stomach problem. Yeah. So chew your food slowly and thoroughly, because when you chew your food thoroughly, it actually help to relax the stomach by releasing the saliva and allow the food to be passed efficiently into the intestine. Yeah. So next is to reduce stress in your daily life. Okay, so this is a behavioral therapy. Why? Because if the stress response is triggered too often, the body has a hard time recovering, and this will actually slow down your digestion and can cause stomach upset. Yeah, so very important is to have stress management. Yeah. So the last one is TCM. In TCM, we have to maintain healthy spleen. And we always, in Chinese, okay, we always say 脾胃, 脾胃. Okay, 脾 is spleen, 胃 is stomach. So spleen and stomach are closely related, okay, in TCM perspective. Okay, because the spleen and stomach are the organ seen in a TCM to be the main ones responsible for effective digestion. So in TCM perspective, the spleen is the digestive fire of the body, transforming our food into qi, and then deliver it to the rest of the body. Yeah. So yellow color food is good for spleen. Okay. And those include yellow color food include corn, soya, eggs, yolks, okay, yellow capsicum, okay, and bananas. These are a few examples. Okay, next. Next, we'll look at the food supplement. Okay, Ganoderma. Okay, Ganoderma, also commonly known as 灵芝. It is a very special type of mushroom that has the healing property. It has been recognized as a medicinal mushroom for over 2,000 years, and its powerful effect have been documented in the two oldest medical books in ancient China, 神农本草经 and 本草纲目. So in the last 50 years of modern scientific research in so-called 灵芝, we can find many evidence-based report published. So if we do a Google search, the keyword 灵芝 or Ganoderma and disease, we can easily get more than 1,000 results shown in the research paper published. And almost all the reports can be found in a PubMed website. So this PubMed website, which is the so-called US National Library of Medicine. Okay, so all have been documented. So next. Okay, so when it comes to selecting 灵芝 product, you will be spoiled for choice in the market. So why would you choose Shuangho? First, okay, Shuangho is one of the world leaders in producing top quality 灵芝. Their main core business is in researching, producing, and marketing 灵芝. The company has been in the business for more than 30 years, specialized in producing top-grade 灵芝product. And head office is in China, and not in Taiwan, sorry, and named as Double Crane. In this Southeast Asia region, is named as Shuangho. The company owns their in-house R&D, 灵芝 farm, as well as the distribution network. Through many years of research effort with its patented extraction process, all 灵芝 products are extracted with the two unique components, terpenoid and micromolecular polysaccharide content. Okay, and the product have been scientifically certified with various endorsements, such as TQF, Taiwan Quality Food, and Halal certified as well as ISO. Yeah. So next. So next we'll look at the function and benefit, okay, of this so-called 灵芝. So first we look at regulate immune system. Okay, so 灵芝 is able to regulate Next benefit, okay, from taking this tincture would be enhanced liver function, detoxification, because liver will filter blood, okay, by clearing the so-called the toxin from the medication and the alcohol. And a healthy liver actually create immune system that fight against inflammation. And the liver is key frontline immune tissue because they are ideally positioned to detect pathogens entering the body via the gut. So liver is also important organ for digestive system. Yeah. Although as we know, liver has many functions, but in the process of digestion, two things they do: make and secrete bile, okay, for digestion. Second is to process and purify the blood, okay, that coming from the small intestine. And all this blood are actually with all the newly absorbed nutrients. So liver is important. Okay, liver function is important. So this taking the 灵芝 can enhance the liver function. Yeah. And the last one would be remove free radical and antioxidant. Okay, reduce free radical. Free radical are those are unstable atoms that we need to remove from our body because they will damage our healthy cell. That's why you need to remove it. Yeah. Yeah. So next. So next we look at the research. So this is the so-called evidence-based research. Actually, this research is actually done by Singapore NUS, looking at how Ganoderma polysaccharide can actually help to improve the gastric ulcer, okay, induced by the acetic acid. So GLPS in short for Ganoderma lucidum polysaccharide. Okay, the team have the research team have actually published the research paper in the 2004 edition of a journal Medicine and Food. Okay, there's a link below if those who are interested can actually take a look. Okay, in this experiment, they have given different dosages of so-called Ganoderma GLPS to the gastric ulcer mice. So this gastric ulcer mice is actually the so-called the simulated injury using the mouse system model, mouse model to do the test. So three groups of so-called injured mice. The control group is without the so-called Ganoderma. Another group with Ganoderma was given 0.5 gram per kilogram. The last group was given as higher dosage at 1 gram per kilogram. Okay, second one is 0.5. The last one is 1 gram per kilogram. Yeah, so they continue the same amount of daily dosage. Okay, for the two groups, second and third group, for 2 weeks. So after 2 weeks, they look at two areas: the size of the ulcer in the stomach and the level of gastric mucus, as well as the so-called the prostaglandin. So this prostaglandin is a hormone that actually make the mucus. So ideally, the size, okay, the size of the ulcer should be smaller, and we should see, okay, so-called the mucus is there to protect, yeah, the so-called the disease. So the role of just now we mentioned about this prostaglandin is actually a hormone. So it's actually to produce the gastric mucosa, okay, from being to protect the so-called the stomach layer. So the result shown that after 2 weeks, groups that given the so-called Ganoderma polysaccharide had 40% and 56% reduction in the size compared with the so-called the first group, which is without Ganoderma. So the reduction in size is proportional to the dosage level. Yeah. So second is that the treatment, the two group treatment with the so-called Ganoderma, they actually show the level, the so-called the gastric mucus is having more for them. Yeah. in terms of the so-called protection level is there. So the study actually showed that the Ganoderma can be a useful herbal preparation for the prevention and treatment of a peptic ulcer. Yeah. So in summary, the higher the dosage, you get a better result. Yeah, and effective for this ulcer treatment. Next, we'll look at another research paper. Okay, so this is a research, okay, of using Ganoderma polysaccharide (GLPS) on gastric ulcer caused by the so-called NSAID, non-steroid anti-inflammatory drugs. Yeah. So the researcher wanted to know what is the ulcer healing effect, okay, on the stomach of the so-called the mice when using Ganoderma GLPS. So the test was using the mouse model also, and they fed the simulated injury mice. Okay, one group with 250 milligram per kilogram, and the other group with 500 milligram per kilogram of GLPS. And the results show that the GLPS is able, the Ganoderma group is able to produce a mucosa healing effect in the mouse model. Yeah. So this gastric mucosa serve two primary purpose. Okay. The mucosa is that to help to lubricate the food masses in the stomach and facilitate movement within the stomach. Okay, and to create a protective layer to protect the stomach wall from acid and digestive enzyme. That's why this test is about this mucosa. Yeah. And next research is, so next another research is using Ganoderma on acute. They want to test on acute and chronic gastric ulcer that caused by alcohol. Yeah. So Ganoderma, okay, GLPS was used. Now the Ganoderma used was from the alcohol extract. So alcohol extract, which is so-called commonly known as a tretopenoid. Yeah. So the experiment aims to see if there is any protection against acute gastric ulcer using Ganoderma. So they're also using the mouse model testing on simulated injury mice. So the result came back was the wound healing of the acute gastric ulcer was actually promoted by using GLP, and which means the Ganoderma, and significant improvement in gastric mucosa were observed. Yeah. So just like I mentioned, mucosa is a layer of the mucous membrane found in the stomach. Yeah. And this so-called results suggest that the Ganoderma administered on can actually provide significant protection to the gastric mucosa. So this is the one that against the acute gastric ulcer caused by alcohol. Next, we look at another research, which is using the Ganoderma also tested on the using the mouse model, also on the simulated injury mice. But this round will be to look at the so-called the chronic gastric ulcer caused by alcohol. Yeah, so they are interested to find out the protection against chronic, okay, gastric ulcer using Ganoderma. So result came back is that they actually found that the wound healing of the chronic gastric ulcer was promoted. The same thing, they also observed that the gastric mucosa, the so-called the diseases, okay, there's some significant change and improve in that mucosa level. So the conclusion is that this result actually suggests that the GLP, so-called the Ganoderma, administered at CV12 and ST13. So these two numbers, these two are the so-called, they actually done it on the two acupuncture point, okay, based on the mouse model, so that that can provide significant protection of the gastric mucosa against the so-called, this one they're looking at the chronic gastric ulcer caused by alcohol. Yeah. So these are the research that they have done. Next, another research is to, yeah, okay. So this research focus on using Ganoderma fruit body alcohol extract, which is a terpenoid, on stomach tumor in the mouse model also. So from the research, actually, they found that the GL could suppress the tumor growth caused by a virus, EBV virus. Yeah. So in this research, they found that they also, in this so-called research, they also add in a so-called another component, which is QCT supplement to supplement so-called the Ganoderma. Okay. So this QCT is so-called has anti-inflammatory effect. That's why they added in. And this QCT is a plant pigment. Okay, it is found in many plants and food, okay, such as red wine, onion, green tea, apple, and berries. So in this research, they found that the QCT supplemented GL could be a potential food to be used for prevention of this so-called EBV, so-called virus caused by this EBV virus, tumor. Yeah. Next. Yeah, from all this research, we found that Ganoderma can be effective in terms of the so-called the treatment for stomach problem. Yeah. Next, we'll look at the supplement product from Xiongho. So other than Lingzi, okay, you can actually go with Yonggen pollen. Why? Because it contains more than 200 plus nutrients. They are good for our body. Okay, nutrients include more than 16 vitamin, more than 16 mineral, and having 21 amino acid, 28 nucleic acid, more than 94 enzyme and coenzyme. Some of the benefits are regulate nutritional imbalance, calm our nerve, and relieve stress, help in weight loss, increase stamina and remove fatigue, fortify our immune defense, and enhance absorption of Ganoderma. Yeah. So in TCM perspective, yellow color food, just now you mentioned, is good, okay, best for spleen. Yeah. So in summary, taking so-called this bee pollen will provide you the energy to keep active throughout the day. Also get the nutrients you need for growth and repair, helping actually you to stay strong and healthy and help to prevent diet-related illnesses such as some cancer. Yeah. Next, another supplement you can consider. Okay, another supplement from Xiongho you can consider is Jiaho instant soya protein powder, which is very good, and they can provide a mucus layer in the stomach. Okay, here is how you prepare the drink. Get 2 sachets of protein powder in a lukewarm water, and you shake well. Okay, not just stir, shake well until fully dilute and dissolve it. Yeah, drink it immediately. This will help to relieve the pain or cushion, okay, and by providing the mucus layer for your in your stomach. So yeah, so don't add any sweetener or other dairy product. This is based on experience. Yeah. So take note that normal soya drink, okay, for this so-called protein powder is a bit special. Is that normal soya drink may actually cause gas and bloating in stomach. For our Xiongho, okay, instant soya protein is not just a soya drink, but it's an isolated soya protein powder, meaning they have purine isolated and removed. So you don't have to worry about getting high uric acid when drinking so-called our soya protein powder. As you know that high uric acid will actually cause gout, okay, if you have gut problem. Yeah. So next will be the lactoberry product. So this lactoberry is a probiotic product and provide what it does is provide good bacteria for balancing our gut flora, because the gut flora help us digest and absorb the food we eat. Okay. In addition, they also provide happy hormone, which is this happy hormone is called serotonin. So serotonin primary goal is to regulate your mood and body function. Okay, but apart from boosting your mood, right, they are also control your bowel movement and help you digest in the so-called in the digestive system. Yeah. Yeah. So next we will look at the so-called the dosage. Yeah. Okay. When it comes to dosage, we our Songho product are safe. Okay, we are safe to actually consume the linzer at any dosage. Okay, so this dosage was based on from many years of so-called research and many testimonials we have. Okay, we know that higher dosage play a role in the healing process. So here is the recommended YK Ganoderma dosage for your reference. Okay, based on the testimonial gathered from all the stronghold leaders. So for general maintenance and prevention, they recommend 4 to 8 capsules. Okay, for therapeutic, okay, effect or a bit of stomach discomfort, minimum is 12 capsules. And therapeutic for more serious conditions such as stomach ulcer or cancer, then mega dose is recommended. Yeah, minimum 30 capsules of YK Ganoderma. Okay. Also take note that you can remove the capsule of so-called the Ganoderma, the capsule. You can remove the cover, the capsule, because if the capsule cause sensitive to your stomach, you can actually remove the capsule and just take the so-called the powder out. Yeah. Next, we'll look at the so-called the 3 testimonial we have. First, these 3 testimonial are from Taiwan. Okay. And the first one is related to a buried esophagus and the long-term consumption of gastric medication that cause the gastric tumor. So buried esophagus is a condition in which the lining of the so-called swallowing tube within the esophagus that connect the mouth to the stomach, okay, become damaged by acid reflux, okay, which cause the lining to be thicker and become red. Yeah, so this is a condition for buried esophagus. So people who have had symptom of heartburn, acid reflux, or so-called GERD lasting more than 5 years are more likely to develop buried esophagus. Yeah. So this condition is associated with the increased risk of developing esophagus cancer. Yeah. So back to this so-called testimonial, Madam 2, okay, age 63, back in 2020, she was a hairdresser, having irregular meal, okay, most of the time, and also suffer from a hypersensitive body since young. So prior to that, she had not taken any Western medication. In year 2018, she had frequent cough, and she thought that it's due to her hairdressing, so-called hairdressing, related, okay, hairdressing with that, because she used those shampoo and all. She thought it was due to that, okay, and eventually they diagnosed as buried esophagus disease. Okay, so doctor prescribed long-term Western medicine for the stomach. So after she consumed the medicine for about a year, doctor found through a normal checkup, the doctor found that a 3 cm gastric tumor in the stomach. Okay, and she started. Okay, at that time she started taking 1 sachet of Ganoderma powder morning and evening daily, and also include 1 sachet of probiotic. Okay, so after for 3 meals, so per day, yeah. So after 3 meals, after every meal, she will take this so-called this dosage. So after consuming the Ganoderma and probiotic for about a month, okay, the tumor was actually shrunk to 0.7 cm. Okay, just now I mentioned 3 cm, and now after 1 month it becomes 0.7 cm. Yeah. So at year February 2020, her baric esophagus condition also disappeared. Okay, she continued the linzer and her condition continued to improve. Okay, even her insomnia, other problem, insomnia problem also go away. So here we can see that Ganoderma is effective for not only the esophagus, the Barrett's esophagus, okay, problem, and inhibit the growth of tumor, but you also have other health benefit. Okay. Next testimonial. Okay, so this testimony also from Taiwan. This is a case related to gastritis, gastroesophageal reflux. It's a reflux and anemia. So the couple are both having a hearing impaired condition. They can't hear well. Okay. So but they own a cafe business selling noodles. So the wife, Madam Xu, started having stomach disease since 2011, and suspected to have caused by the H. pylori infection, and also lead to gastritis and so-called gastroesophageal reflux. She was taking long-term Western medication, okay, due to that problem. Yeah, because of her gastritis and reflux condition, she had been admitted to emergency, okay, ward 5 times. Yeah. So a friend recommended her to try linzer. Initially, she tried a few capsules, but no effect on her condition. So she started taking higher dose, okay, 20 capsule of Ganoderma, 40 capsule of bee pollen, and 5 sachet of probiotic product daily. And since then, she started to see improvement on her health. Okay, no more suffering from the so-called, she used to have a so-called fainting spell. Okay, so now after taking with this high dosage for a while, no more suffering from a fainting spell. So what is a fainting spell? Fainting spell is generally, okay, it's lasts for a few seconds to a few minutes. Okay, and also previously due to her stomach problem, she tried to avoid coffee, but now, okay, she's better. She can even consume about 3 cups of Ganoderma coffee daily, and her appetite also improved a lot. Yeah. So she continued the linzer. Not only, okay, her health condition has improved, her hearing also improved. Yeah. So yeah. So next testimonial. So next testimonial is related to so-called the stomach ulcer and the reflux problem. So Madam Chang, age 73, okay, back in 2020, had been a business owner for many different kind of businesses. She was diagnosed with hypertension, polyps in the stomach, okay, stomach ulcer, and the reflux problem at age 65. And she also had dengue fever for 2 times. So after the second time of dengue fever, she worried. So she started taking 1 to 2 capsules of linzer and 1 sachet of high concentration of linzer powder. Her reflux problem started to improve gradually. Okay, so stomach feeling better, much better, and appetite improved. Okay, as well as her body stamina. Okay, she also include the probiotic together with linzer. Okay, she used to have frequent headache and sinus problem since young, but after consuming linzer, okay, with this dosage for a while, she no longer has all these problems. Yeah. So in summary, okay, long-term consumption with sufficient dosage, okay, of linzer can improve and solve your stomach ulcer and reflux problem. In addition, your overall health condition also can be improved, as we can see from the last 3 testimonial. Yeah. Okay. Next. Now we come to a conclusion. Yeah. Okay. First is the stomach disease are often in chronic nature, meaning long term. Okay. One should pay attention to the pre-illness symptoms. Okay. See a doctor if you have frequent stomach or reflux problem. Okay. The stomach disease can be second. The stomach diseases can be prevented. What we need is to put in effort to have a balanced diet, do regular exercise, learn to relax, and manage your stress and sleep well. Get early medical check and treatment. Okay. In addition to that, you can take health supplement while undergo Western treatment. So Ganoderma is one of the best health food to prevent on stomach disease. Okay, but should not view as a mainstream medicine for the disease mentioned. Yeah. So this one we can actually just now reference to the 3 testimonial. Yeah. They have a very good result. Yeah. After taking the Ganoderma. Lastly, other stronghold products such as bee pollen, instant protein powder, and lactobacillus can be consumed as part of your balanced diet formula. Yeah, with that, I end my presentation. Thanks, everyone. Thank you.